Thank you. Is there any public comment on items now on today's agenda? All right. Seeing none, let's dive right in. Aaron Couch, you have a whole number of items for us. Why don't you just dive in and introduce these?
Sure. And I'll make a quick note. Terry, I couldn't click on the Teams link from the agenda, but I could from the email. So if you have the email that I forwarded from Violet, the link that's in the email tends to work, but not the one in the agenda. So just something to try. But thank you. I'm Erin Kautz, part of Community and Planning Services. Do you want me to talk about so I have the first 5 agenda items. Do you want me to talk about them all together? Okay.
Let's talk about them all together, and without objection from the other commissioners, we'll just vote on them as a whole. If things start to go off the rails and get highly controversial, we can pluck one of these out to deal with. So
anything could happen.
Go ahead.
Great, thank you. And Teresa Williams and I believe Terry Kendrick are both here to answer any questions if you have specifics. I don't know if anybody else is here to answer questions as well, but we have a couple of different contracts related to our county and tribal matching grant that we have received from the state, from the Department of Public Health and Human Services. And I need to go back to the agenda to see which specifically they are. So the first one is to provide funding for the Missoula County Mental Health Coordinator, which is at Partnership Health Center, and that position is currently held by Gretchen Neal. And for specifics of that program, Terry would be able to answer that, but I know that there's some that are listed as well in the RCA that you have.
Can you hear us?
Hang on a second.
Well, Erin can hear us.
Folks can hear us.
Okay. Apologies, that was me, commissioners. I was messaging with Chris. I didn't realize he was logged in. I apologize.
Okay. Let's start at the beginning. Is there any public comment on items not on the agenda? No. Go ahead, Erin.
Okay. Could you hear me?
Yes.
Yeah, we're good.
Yes.
Okay. So I'll just continue then where I was at. So the first one was for the mental health coordinator. The second one is for a referral and outreach coordinator, which is Western Montana Mental Health Center. As you may remember, this is a position that works closely with on the involuntary detention cases with our county attorney's office and the public defenders who work on those cases when there's an emergency detention and then the person is stabilized and gets back in the community. This position works kind of as a case manager to help that person basically, meet their appointments, get settled, and all those sorts of things. And then they also do some outreach to some of the more vulnerable positions in our community. The next item is for a CIT data analyst. That's a crisis intervention team. And Teresa is on the phone or is on the meeting to answer any specific questions. She is our CIT program manager, and she is at the City of Missoula Fire Department, but she works with both city and county law enforcement, first responders, and all the other folks that make up our CIT team. And this will be expanding that program to look at the data and really determine how we're doing in certain areas, where there's still a need, and then looking forward how we can best fit that need. The fourth item is a new position that we had funding for this year, a tenancy support specialist, which is going to be at Partnership Health Center. And this is going to be working closely with the FUSE program and helping, I believe, retain some housing for folks. And Terry might be able to speak some more to this as well. And then last is it will help provide some funding for the mobile support team, which I know you are familiar with as well. So any specific questions about any of those items?
Or Terry, is there anything you'd like to add first?
No, other than to say that all of these positions are valuable, and I hope you support them.
Terry, what's the tenancy support specialist going to do exactly?
So is that different than the housing specialist?
Well,
Sorry, go ahead.
the tenancy support specialist, and I will address this as best I can. So it's under the FUSE program, but also Partnership Health Center will be working with folks in the temporary safe outdoor spaces, and that person will be working to help them try to attain and retain permanent housing.
Okay, so this is helping people get into housing who aren't housed right now.
Right. And also then once they are housed, helping them make sure that they have the resources and the services they need to retain that housing.
Great. Okay, thank you. That's some good clarity.
Is this a new position or just a kind of a rebranded position that already exists?
Thank you. Yeah.
Do you know, Terry?
I do not know, so I will I'll let you know.
You got the landlord liaison.
So I will say, this is
There is already a housing person over in Partnership, I thought, and that's why I'm wondering, and I think this is Juanita's question, whether these are two distinct positions or whether this is just the new title for what already exists.
So Anna Nillis is over at Partnership, and this position would work under Anna because Anna is the FUSE specialist. And this is actually a new position. But what I had heard, and I'm not sure, and Teresa, you might know actually this as well, but is hi Teresa, so the terminology that we use, the tenancy support specialist, that was specifically identified in the grant in the grant application as something that we had to ask for. So it's not something that we came up with or rebranded or anything like that. It was basically dictated through the requirements of the grant. And so, but my understanding is that there was a position from like maybe the Poverello, and Teresa, can you speak to this at all?
Sure. This was initially when we were standing up the coordinate entry system and looking at the entire system and recognizing some system-wide gaps. So we looked at having the landlord liaison, the housing navigator, and a housing retention specialist. So my understanding, and not speaking for Partnership Health Center, my understanding is that this housing tenancy support specialist is that housing navigator at Partnership. So this is the funding for that. And then I believe at the state level, they're also looking at ways that Medicaid can pay for housing tenancy support, and that is through the HART Act, right. I believe.
Okay.
Don't quote me on this, but that's what I believe. And the former housing navigator through Partnership moved over to another agency, and so they might be hiring for that. I don't know if Terry, if that helps jog some information on your end too.
Yes, so I think that position is open, but also will be hiring the tenancy support specialist. So they are two separate positions.
So Teresa, Teresa, while you're here, I'd ask you a question about the data analyst. So I'm really excited about this and feel like we're going to make better decisions when we have real information. For people who are just tuning in, they may be wondering, like, why do we need a full-time person to keep track of data for one program that's pretty new and isn't very big? And so could you describe the rationale behind that?
That explains it perfectly. Why? We need to have a data and we need to make data informed decisions. And so this is something that we should be doing in the beginning of a program, is have our evaluation, our research plan, all of those pieces, so we know that we're effective. You know, from my standpoint in looking over the CIT program, we don't know how effective we are in training our law enforcement. We need someone to look in and, you know, be able to code when a CIT officer is on a scene or on an incident and look at those outcomes. How much time did they spend? Was there a decrease in use of force across all the CIT officers? So really looking at it from that perspective, but it's so important that we have a single point of contact, someone that is working with all of those agencies that have CIT trained officers, and evaluate that our training is actually making an impact on the population.
Great.
Thank you.
Yeah, thanks.
And I just realized I was thinking mobile crisis unit, not CIT. So
Correct. So CIT, I think there might be some overlap in looking at the entire crisis continuum. You know, this person will need to kind of bridge and ensure that we're tracking all the data elements needed within 911, within the sheriff's department, within the police department, so we can really pinpoint when we have someone in a behavioral health crisis, are we dispatching the right resource, and what is that looking like on the outcomes end? So I think there will be some overlap with the mobile support team as a crisis response, but they are going to be housed in looking specifically at the CIT components. But of course, of that is mobile support team because they also come through our academy. They're intimately involved in the crisis continuum. And so it'll be nice to have that dedicated person to kind of map all these things out, help us visualize the data, and make sure that we're on track.
Teresa, do you think this person could do some qualitative as well as quantitative data?
Absolutely, yes.
Oh, fantastic. You're saying all the right things.
Yes, and so, well, part of this too, we are looking at working with the university's Center for Children, Families, and Workforce Development, and they are the experts in data, and so we're hoping to contract them, so we'll have some vacancy savings. We're in the process of recruiting for this data analyst, and so the university is going to pretty much package this for us and what kind of data system we need to use, what are the data elements we need to collect, you know, what does the entire plan look like? And then once we hire this data analyst, the university will have set them up for everything they need so they can hit the ground running, because one of the aspects of this grant is that it ends June 30th, 2022. So we need to hit the ground running as quickly as possible on this side of things. And so hopefully that answers your guys' questions.
That's great.
Well,
thank you very much.
The other thing I would like to add, because Teresa never toots her own horn, is that she's now on the board of CIT Montana, and that she has also been doing some traveling statewide and helping other communities across the state set up their own successful CIT teams. And so a lot of the work that we're doing in Missoula is being, you know, replicated throughout the state. And so other communities are creating Teresa's, and so, but we're the first community that's also expanding into this data. And so it will be really interesting to see if we can start figuring out, you know, what we need to collect and how to collect it, and then we can share that as well with other communities. And I think that will be really helpful as well.
All right, thanks. Okay, we've got items 1 through 5 here. So
move to approve items 1 through 5.
I'm going to second that.
any further discussion or public comment on the motion?
But can I make one comment?
Sure.
Way to go writing a great county tribal matching grant, so we got all this money.
Yes.
Thank you.
All right, let's go ahead and
Thanks,
vote. All
everyone.
Aye.
Thank you.
All right, thanks, Aaron. Thanks, everyone.
Thank you.
All right, from social services to equipment, Deb Clark, we've got a belly dump and a shop.
I thought you had a belly dump. This is the second belly dump.
No, this is the one we just bought. They were in our budget for last year. We always get approval to first to purchase it and then to pay for it. So that's where you may have heard of this one. But we went through Sourcewell, which is is approved to go through for the governments. And we found that Titan was the most reasonable and had what we wanted. And so they received it, I think it was in end of September, sometime in September, and it's been wonderful. It's something they've asked for a long time. So we're just asking that you approve it so we can finish the payment process.
Great, yeah.
Want to do both?
Would you do this?
Let's do them both. So, anything else you want to add, Deb?
Do you want me to go ahead and go to the next item too, or?
Let's dispense with the shoplift while we're at it.
Okay. So this was approved in last year's budget also, and we went through Sourcewell. And this is something that we have needed for a long time because it can lift the trucks up, the big trucks up. We only had one, so it's made it so much more efficient out there for the guys. And of course, you know, it saves on their bodies and everything too. So this has been a great purchase. So we got that one also through Sourcewell. And so we'd like to have you guys approve it so we can go ahead and pay that one also.
They don't have to lift things by hand.
Oh my goodness. So, for people who don't know, could you describe what Sourcewell is?
It's a government. They do government bids and stuff. So they go through and you let them know what you're looking for, and they go through and find the most reasonably priced items that you want. It saves us actually from having to go out. It's kind of like the middleman. What was that?
Our resident procurement expert, talk to us about this.
Hey, good morning, everybody. So Sourcewell is a very cooperative purchasing group started by a government in the Midwest somewhere. And the reason for their existence is to simply make purchasing for governments a little bit easier. So they send out RFPs on their own, and then we can kind of piggyback on their contracts that are the result of those RFPs, a lot like we do with the state of Montana sometimes.
Great, thanks, Dave.
You bet.
Thank you, Dave. You explained that really well.
Oh, no problem, Deb.
Something?
I don't know. I don't see his hand.
Oh, no longer hand up.
Item 6 and 7.
Yeah, I would move that we approve items 6 and 7.
Second.
Any further discussion or public comment? Seeing none, all in favor?
Aye.
Aye.
Okay, thanks, Deb.
Thank you, guys. Have a good day.
You bet. Kara, thanks for joining us. So we have a task order here between DPHHS and Missoula County Health Department regarding the Healthy Montana Families Home Visiting Program.
Yeah, so I think you've all heard a little bit about this over the last few months, but this is the federal McV funding, maternal, infant, early childhood home visiting funding that we've been receiving now since 2012 for nurse-family partnership, and over the last year also for parents as teachers, both evidence-based home visiting programs. And we had to go through the RFP process again for this money this year, and we knew going in that we were going to be receiving reduced funding because of some issues at the state level, and this is through the Healthy Montana Families Office at DPHHS. So we were looking at like a 40% reduction in the money that we were going to receive. We did receive the full amount that we could have received for Missoula County, and we have been working with you and other community partners to bridge the gap and keep our programs whole for this for this year, and are also looking at other options down the line for sustainable, funding for our home visiting programs. So, any questions?
Questions?
Nope. I hope we can find funding.
Yeah, we've been
make this work.
Yeah, we've been in on this, so we're hoping the partnership holds and we fill the gap.
Absolutely.
I move that the board approve and chair sign the task order.
I'll second that.
Further discussion or public comment on this item? Seeing none, all in favor?
Aye. Thanks, Kara.
Yeah, thank you.
Sarah Heineman and Erica Grindy.
Hi.
Together.
Thank
Hi.
Erica is not, she's in another meeting, so I'll cover this unless there's specific risk questions you might have, but this should be pretty simple. This is a renewal of our annual amendment to our contract that the health department holds with Risk and Benefits to provide flu shots at the county health fair. Since we're not having a county health fair this year per se, we are doing a drive-through clinic specific for county employees who have the Risk and Benefits insurance. And so that's occurring this Wednesday, tomorrow, at the elections parking lot. And so it'll be a drive-through flu clinic. I think this morning, the last I heard, we had over 120 people signed up already. So it'll be a busy day. So it's just an annual amendment to our usual contract with Risk and Benefits for this specific service.
Sarah, does an employee have to sign up? Can you just appear? Does an employee have to sign up, or can you just roll in?
You can just roll in. It is helpful if you pre-register so that we have some of your paperwork pre-filled out and can base our inventory how much we need to bring with us. But we can also be accommodating. So either is fine. Preferred to sign.
Where would a person go to pre-sign up?
I can get the link for you, and I can send it in this chat if that makes sense, if that would be the easiest, or I can email you.
You
Put it in the chat to
put it in
share
the
with
chat
everyone.
would be great.
Okay, all right.
And the last question, I get drive-through, does bicycle count?
Sure.
Thanks.
Yes, absolutely.
Are you virtue signaling?
Am I what? Oh, no. I'm actually wanting to make sure I can.
Just kidding.
There's no virtue in. Now I feel terribly guilty. I didn't mean that at all. I was just trying to see if I could do it on my way home.
What are the hours for this, Sarah?
This clinic tomorrow is 10 to 2. And then, of course, there are lots of other opportunities to get your flu shots. Wednesdays are walk-in day at the health department, so you can come in. You can schedule appointments Monday through Friday. We're doing a big community clinic next Thursday, the 14th, also out at the elections parking lot. We're going to Imagination Brewery Friday, the 22nd in the evening. So there's lots of opportunities that you could get a flu shot.
And can you share your prediction for this year's flu season?
We're gonna have one.
I've never had a flu shot my entire life, but
I've heard it might be bad.
Exactly. My doctor
not the flu shot bad, the flu season.
Yeah.
The flu season is bad
I
this
got
year.
one last year, first time ever, and my wife got the flu really badly, and I didn't.
Oh, I thought we didn't have any flu in Missoula County last year.
This was in February, pre-COVID.
Got it. Okay.
Well, it must have been a year and a half ago.
Get your flu shots, folks.
Yes, get your flu shot. It's important. We didn't have any last year because people were really, really good with their protective measures, such as hand washing and staying home when they were sick and wearing masks. And people were much more limited in their activities, and everybody has pretty much gone back to normal behavior. So we're going to see a flu season. It's just a question of when, and then how bad it will be. We don't know, but we expect flu. And flu with COVID is just it's not going to be a fun mix for our medical providers and hospital communities. So.
Not at all. No. Okay, should we do this?
Yes. Which things we have?
We're on 9. We're just doing number 9.
Number 9. All right. I would request that I move that we approve the board side amendment 5 in agreement.
Okay.
Second.
Further discussion. What comment? Seeing none, all in favor?
Aye. Thanks, Sarah.
Thanks. Jason Emery, we have an annual true-up with Dell, and I think this includes a cyber colonoscopy on the annual true-up.
That does not sound like a lot of fun. Yeah, I didn't really sign up to be in the colonoscopy business, but yep. So this is the third year of a 3-year contract we have with Microsoft via Dell. Dell's our reseller in this instance. This is all of our Microsoft licensing that we use, which is quite a lot. So it covers all of our Office and emails and Teams and SharePoint and OneDrive and Windows, all those things that we use to make all of this possible. And I'm very glad for it, to be honest. So it actually came in slightly under projection, so that's always good. We were able to just really go in and do a deep analysis to look at number of licenses that we actually need. We're still having to keep a few more on just because of the ramp back up in health workers, contact tracers and such. So we're hoping to wind that down a little bit further this year, but since we can't, we're hanging on to some of those licenses. And so yeah, it'll get us going for another year. And this time next year, we'll be looking at a new 3-year contract when that comes around.
Okay, any questions for this?
Should we do the next one too?
Yeah.
Sure, let's move right along. Cerium Networks, Jason.
Yep, so this is for telephone services. We'll be using some cash reserves, some money we had left over. And essentially what this is going to do is to hire Cerium, who is our reseller and vendor for our phone system. And one thing we really noticed during this pandemic, and really even during other issues, floods, fires and such, that we really could use more capability when it comes to our call centers. So the telephone services group did a spectacular job over the year and a half of setting up, call centers at the university and various places on a moment's notice to try to handle, all the calls with COVID and vaccines and all those things. Fairly routinely, we set up call centers for, again, if there's fires or floods or other emergencies that OEM is handling, as well as we have ongoing permanent call centers, and that would be Partnership Health Centers, probably our busiest. So they actually have a number of agents that sit over there and take calls from patients all day long, doing scheduling, answering questions, all those things. Treasurer's office, the health department, various other offices have that as well. So what this will do is allow us to basically go to a little more premium version of the call manager. So we'll have more intelligent call routing. We'll have more information available to the managers that are managing those call centers so they can get a better idea of the volumes and kind of how well and how efficient we're being with answering those calls. Do we need to staff up? Do we have too many staff? How long calls are taking? All that sort of thing. So it's just really kind of a natural evolution of the system as we continue to grow and become more complex.
Okay. Any questions for Jason?
No, I move that the board authorize Jason Emery to sign items 10 and 11.
I'll second that.
Okay, further discussion, questions, public comment? Seeing none, all in favor?
Aye.
Aye. Thanks, Jason.
Thank you.
Thank you.
And last but not least on the action item list, Emily Brock, $12 million contract.
Violet has
amendment
something.
here.
Oh, did Violet pop in?
Hello, can you guys see me?
We cannot see you. You are black screen there, but
Where? Sorry.
Violet, do you have something? I'm sorry, Emily, Violet just typed something and said on the last action item.
Not a
Can you guys see
problem.
me
That
now?
is just a message for Chris. Emily, we can see and hear you.
sorry about that. Emily Brock.
So this item is this is the big GMAX amendment for the Rocky Mountain Gardens and Exploration Center. There will be one more coming in for the balance, but it's going to be a lot smaller. This is for a little over $12 million. It is for, we've already pre-purchased the steel and we're doing the foundation and groundwork now with utilities. But besides that, this is for really the bulk of the project. This is for building the building. And we've been working closely with Andrew. Once this is signed, we'll be able to start moving forward on our financing package, and the Rocky Mountain, the Butterfly House we're all settled with their contribution, and that's looking good of 3.2 million. And so, yeah, this is the big one. I see Andrew, you're on. Do you have anything to say?
Andrew?
I don't have much to add there. I know this is the big one, and we've been doing a good job of keeping close eyes on the budget going forward. And this is really where we expect it to be at this point in time. The next one's going to be very small, as Emily mentioned, and we should be able to handle it in financing.
Great. Questions? Yeah.
So Martin, do you have anything to say, or this is a big deal?
Well, Jerry's on too, so Jerry, do you want to add?
Jerry, is there anything you'd like to add?
This is Jerry Marks from the We District and Extension Office. Hey, this is a time of excitement for us. We're making a lot of addition to the fairgrounds. And as they talked about at our groundbreaking, helping people connect with the land, the plants, the insects, it's really going to make a big difference. So we're excited about moving forward.
Hey, thanks.
Thanks. And back to Josh's question.
I was just throwing Martin a softball here, man.
Yeah, just what's the timeline here, real quick?
The timeline is about 18 months.
We have Chris in the room too, which made me wonder.
I have the next time.
Oh,
okay. Any other questions? And this is the big one, hopefully not in the Fred Sanford variety of big ones for 70s era sitcom lovers. Okay, how about a motion?
I would move we go forward with the maximum price amendment with Jackson.
Second.
Further discussion or public comment? Seeing none, all in favor?
Aye.
Aye. Okay.
It's happening, Jerry.
It's happening, Jerry.
Yes, that is great.
Emily, you are moving forward with the, Emily, you're moving forward with the statue of Jerry on a horse that's going to be somewhere.
Not a chance.
Oh, you're moving ahead with that.
Yeah, we'll be right near the Statue of Liberty.
Thank you.
Also to scale.
Yeah.
All right. Correspondence. Pre-trial services contract extension letter.
Yes,
Chris.
so good morning, commissioners. Covering this for Chantel, who's not able to be with us. She was double booked this morning. So as you'll recall, we've been working our way through a pre-trial service review project with a steering committee on which Commissioner Slotnick sits and several other members. As part of that process, there will be some changes made to the way that we do the pre-trial services program, but we need some time to go through and work with our contract provider and outline those. And so what this letter does is request a one-year contract extension with Missoula Correctional Services, which is our partner in that space, and ask them to outline pricing and those things for this next year so that we can budget appropriately for that. So this is a really short and sweet letter that just makes that request to Missoula Correctional Services for your consideration today.
Okay.
Great. And then this,
no, this will come around via ready sign.
Great. Yeah, so then this will kind of begin the process of a conversation process with MCS on how we take what we've learned and incorporate that into what will happen over the next year.
And continue to move us in new directions in that pre-trial space.
Great.
Absolutely.
So exciting. We've been talking about this forever, so it's wonderful to take more steps forward.
Okay. We will see this in our inboxes soon. And we have one discussion item. I'm assuming this is a Diana Mineta item. This is regarding the formation of a Missoula County carbon neutrality team.
Yes, thank you, commissioners. So this item is related to the goal that the county adopted in 2019 of carbon neutrality in county government operations by 2035. As you all know, the county is committed to addressing climate change, and this inward-facing goal, looking at county operations, is really complementary to our outward-facing climate initiatives that are underway, such as the 100% Clean Electricity Initiative and the Climate Ready Missoula Adaptation Plan. So I have circulated a draft charter for a carbon neutrality team, a new team, which will be an internal team of county staff representing various departments and leadership roles, including a county commissioner representative, and I believe Commissioner Slotnick has agreed to serve in that role. And the purpose of this team will be to develop a plan to achieve that carbon neutrality goal in government operations. Just for context quickly, as you all know, the county has several efforts underway already to reduce our carbon footprint as a government. We're installing solar arrays on a couple of county buildings, including what will be the largest rooftop solar array in the state at the detention facility. We're working with McKinstry to identify energy saving opportunities at our two largest buildings, the detention facility and the courthouse. And so in that context, the purpose of this new carbon neutrality team will be really to look at the big picture, recognizing what's already underway, but identifying what else will be needed to actually achieve carbon neutrality, and looking beyond our buildings and facilities to also consider other aspects of our carbon footprint, including the county fleet, the water and wastewater systems the county operates, employee commute behavior, et cetera. So I'm expecting the development of this plan with this internal team to be approximately a year-long process, and hoping if folks are on board to move forward and schedule the first meeting after this discussion today. I'm happy to discuss or answer any questions.
Thanks. Any questions?
So excited. Thank you for serving.
Oh, thank you
Thanks
for
for putting
allowing
this
me
together.
and for inviting me.
Diana, are you aware of any other county carbon neutrality teams in the state of Montana?
You know, different, not that are active now. I know the city of Missoula had a group of people working on their internal plan several years back, but that particular group isn't in existence. So I guess I can't point you to one exactly in this model right now, Commissioner.
Martin, I think we can safely say we are probably the only county carbon neutrality team in the state of Montana. I think that's what I heard Diana say.
Diana, do you know, are there some other good examples we can look to nationally?
Oh, for sure. Yeah, there are many local governments around the country that have committed to carbon neutrality in government operations and that have developed plans to get there. So I think I'm certainly intending for us to draw on best practices as we're from around the country as we're pursuing this goal.
Great, that's exciting.
Yes, excellent.
Yeah.
Thanks, Josh, for serving.
I'm excited to be part of that.
Any questions from folks out there in the ether? Martin, anything?
Can I ask?
Yeah, absolutely.
I think in the past, Diana had said that I believe that the county's buildings was one of the largest greenhouse gas contributors. Is that correct? And as you guys look at the courthouse, will this climate or carbon neutrality play a role in your plans there?
You mean the federal building?
Or the courthouse?
Yeah, sorry, federal building.
Yeah,
the federal building.
The old federal courthouse in the federal building.
Okay.
Yeah, Diana, do you want to talk about, I guess, both what's the most carbon intensive portion of Missoula County operations and also moving forward with the federal building?
Sure, yes. So according to the greenhouse gas inventory that was done for Missoula County operations back in 2017, buildings and facilities is the largest contributor to our carbon footprint. And Martin, I think that you've seen that document. It's on the website. I can point you to it if you'd like, recognizing it's a few years old now. And yes, certainly the carbon neutrality goal has been a part of the discussion that I've been involved in related to the potential acquisition of the federal building. The county did also adopt along these lines earlier this year a energy efficient building policy that's intended to help implement the carbon neutrality goal for county owned buildings, and that has really concrete requirements related to energy efficiency for new or major renovations of county owned buildings. And so that's also something that will be taken into account in any activity around the federal building. Does that help answer your question?
Yes, thank you so much.
Sure.
Great, thanks. Any other questions? Okay, well, thanks, Diana, and that ends our business for today. Anything else anyone wants to bring up right now? Okay, seeing none, we'll see you at admin on Thursday of this week. Have a great day.
Thanks, everyone.
Goodbye.